Good morning, good afternoon, good evening, everyone. We're just going to give it another minute or two for more attendees to arrive, but we're very glad that you're joining us for the MenCare webinar today. Give it just another minute or so. Thanks. Well, I'm sure some more people will join in a moment, but we might as well get started. We have some introductory moments here to acquaint everyone to the webinar anyway. Por favor, si necesitan escuchar en español, den clic en icono español abajo en su pantalla. Okay. So we do have Spanish simultaneous interpretation, which we're excited to offer you. Welcome to the MenCare webinar number 4 in a series of 6. Today's theme is Invest in Care, Measure It, and Disaggregate by Gender, Social Class, and Age. I'm very excited about the presentations we're going to share with you today. We have 3 amazing guests joining us from outside of Equimundo, as well as some remarks from Equimundo's CEO, Gary Barker, to come. And I think all of the panelists are going to give an interesting, different perspective on the value of investing in and measuring care. We will save plenty of time for a discussion after the presentations have finished. What I'd like to ask you to do is, at any point throughout the session today, please just put your questions right into the chat, and I and the others on our team monitoring the chat will keep those ready for the Q&A session toward the end. I would like to just quickly overview the look of the agenda, which you're seeing in front of you today, right now. You will have an introduction and framing around the recommendations emerging from the State of the World's Fathers report this year by Gary, which I mentioned. Then, since I am also a co-author of the State of the World's Fathers report, I will give just a quick presentation of some of the data points we found there. And then I'm going to hand it first to Kehinde Ajayi from the Center for Global Development, followed by Lorena Pastor from the ILO, and finally from Tanima Ahmed from the World Bank. Those are our 3 amazing panelists today. We'll work through them in that order. And like I said, post any questions as we come. But without further ado, I think, Gary, I'm going to hand it to you to frame us and get us started. Thanks.
Hey, greetings, everyone. I'm thrilled to kick this off, the 4th in our State of the World's Fathers 2023 webinar series. We are now at the letter I in the caring, and I'll do this a little bit backwards of coming back to those, but I want to frame this a little bit, particularly around the investment issue. So if you click on to the next slide, how do we think about investment in the care economy? We're thrilled to have 3 key voices in this who represent both their organizations who have been thinking a lot about what investment strategies look like. I won't talk much about that, but I just want to talk about framing this issue. I think often we hear about investing in care as somehow as contrasting to investment in the productive side of economies. And I think it's important just to start with some big figures. One is that the care economy is at least 11.5% of the global workforce. It is a huge part of paid work, in addition to all the unpaid work that feminist economists have also been calling for measuring over many, many years. We know that care represents up to a quarter of GDP in some countries, that number even higher based on some estimates. So I think it is important that we start off with thinking about that investing in care, public funding, private funding, personal funding put to care is not instead of investing in the productive economy. It is the productive economy. And I think you'll hear from speakers as well just how much investment in care as a public state investment consistently demonstrates positive returns on investment. And we'll hear about ILO's calculator for this. And there's kind of any measure you put in there of an investment in a care policy leads to a positive return on investment. So I think we have to say quite, eyes wide open that the investment, the lack of or the underinvestment in care is not a technical. It's not as if we don't know what can work or that we get important returns on investment. It really is political. And I think we have to be willing to say that. The next slide, please. There are gender backlash forces who want to keep saying that care is the family responsibility, by which they mean to say this should continue to be women's work. And they are quite happy for it to be done by women outside the paid workforce. And they would very much like for women not to be speaking and not to be in public places. And I think we have to acknowledge that this topic is part of pushing back on the huge backlash toward feminist policies. The issue is we often, I think it's easy to get a bit gloomy. And as we are in the US one more time, looking at the, on the brink of a government shutdown from conservative forces, I think it's easy to feel like we're somehow losing. But if we bother to ask, and Brian will talk about some of the data from the State of the World's Fathers report, our research and others, if we ask parents what do they want across political divides, they tell us they support universal paid leave, childcare, and social protection policies that enable families, individuals to have the care that they support. So I want to just, end on, certainly as we think about what investment looks like, UN Women has suggested that we need to think about these gaps, that it's not just, there is a need to pay attention to how we invest, that we make sure that services are universal, that we look at the gender equality aspects of care, and that we look at being transformative in how we invest, that we look at co-responsibility, the key role of national governments, but also looking at local, state, provincial governments, and bring the private sector along board. That we have to look at intergenerational solidarity. We shouldn't look at this as we only care about care for parents with young children, that we look at elder care, care for the disabled, and other care arrangements. And that we think about equity from urban to rural and across different disadvantaged groups, that it's not that an intersectional lens is necessary to apply to this. And I'd say we must mind the voters. Let us think about how we promote care and care policies to voters, because ultimately that's how we will ensure that they continue. We asked some questions in State of the World's Fathers report. I'm not going to go into these numbers, but I will call your attention to that with a couple of exceptions, men and women, fathers and mothers, say the same thing. They put at the highest, the most important issues to their lives: income stability, healthcare, childcare, pretty equal. More men support, but it's not a huge gap there, support military and national security issues, and more women support women's rights and gender equality issues. And there is a sizable gap there. So we're not done in terms of needing to convince men to support the care investments that we need. But if we talk to men as voters, and if men vote as caregivers, which the majority of us are, we tend to support the same policies that we all need in terms of care. So I just want to bring that in there. As we look at the schemes, look at the approaches, we also have to think about how do we bring men into the equation as voters and citizens who care about care. So here we are, we're in the I, invest in care, measure it, and disaggregate by gender, social class, and age. Thrilled to then be able to hand it over. This is actually 2 recommendations in 1 letter. But one of those, of course, is the investment side. How do we make sure this is included in national government budgets, as well as local, provincial, state, as I mentioned before? And then recommendation 13, also part of this letter, collecting regular data on time use and unpaid care, how it's divided between women and men, girls and boys, and measuring progress in terms of whether we're getting closer. And with that, I will hand it over to Brian to say, what are we seeing in the data? There is some encouraging news, but we're we're a long way from achieving the equality that we all need. Thanks, and Brian, back to you.
Sure, thanks, Gary. I realized I forgot to introduce myself at the beginning of the session as well, but I will be moderating the panel today, as well as presenting momentarily. My name is Brian Heilman. I'm the Deputy Director of Research here at Equimundo and co-author of this edition of State of the World's Fathers, as well as a few from the past. So I've been involved in this effort and initiative for quite a while. What I hoped to do in just about 10 minutes or less is to give you just glimpses of how in this year's edition of State of the World's Fathers, we tried to be pretty creative and, dare I say, maybe pretty intersectional in how we were trying to measure care and its impact and influence in folks' lives. There's really going to be no way to summarize the riches of 17 countries worth of data in this report. So, of course, we encourage you to download the full report, to peruse it, to look at how countries from your region are showing up in the data. But I thought today's session around the need to measure care and measure it creatively and accurately was a prompt to show some of the new ways that we try to, of course, do the time use calculations, but then go beyond that. So first, let's dive right into how we tried to measure men's and women's comparative use of time and time spent on various care tasks. Now, we tried to be pretty creative about this, breaking out different forms of childcare, from the physical childcare to emotional well-being for children, also cleaning, taking care of the house. But we were looking as well at physical care for elders, emotional care for elders, care for family members with disabilities. And as you can see in later slides, we tried to examine what care means even in one's community or for one's environment. Now, it would be too much to show you on a short presentation the men's versus women's comparison of time use for every single country, every single one of these. But the theme certainly does emerge that women continue to do significantly more care work than men in the aggregate across all of these countries, with the highest ratios being around house cleaning, physical childcare, and emotional childcare. Now, we do want to have some kind of cautious optimism in reviewing these numbers, that in some cases the ratio is getting pretty close to one another, but the truth nonetheless is that men are still falling behind women in terms of the amount of care work they're doing, even though perhaps the trend is moving a little bit toward equality. Now, let's move on. As I said, we're also trying to understand these things in more complexity. So one thing that we did is to take all of the respondents and understand, actually ask them which of all of these elements of care work they are undertaking regularly. And it's just important to understand that no one is doing physical childcare alone or emotional childcare alone or only one form of care. Vastly across our studies, the respondents are doing many different forms of care all at once in overlapping ways, in ways that compete for their time availability. And so you can see here that actually it's much more likely that folks are doing more than one type of care out of all the ones that we're asking about as compared to others. And in fact, one number that kind of jumps out to me is that there are, we're doing a fatherhood report here, but we need to really be thinking beyond childcare only. And if you look down about 5 items on this chart, you see that 7% of the study participants are doing all 4 types of care that we asked about: care for a child, care for their partner, care for an elder family member, and care for a family member with a disability. And that's about equal, but slightly more than those who say they are only engaged in childcare, right? So it's more common that folks are doing 4 types than they're doing childcare alone. Another thing we tried to do in terms of an intersectional perspective is map folks' experience being caregivers across the kinds of supports that they have available to them. So, based on your economic background, your setting in the world, the availability of low-cost childcare, or even the proximity of family members who can support you, these things really make a difference in your felt experience of care. So what you're looking at here is the proportion of people in all of these countries who told us that caring for my children is more exhausting than enjoyable. So just feeling that kind of overwhelmed, that burdened sense of, I do love caring for my children, but it's a little bit more of an exhaustion for me than something enjoyable. And it's really small to see it on your screen, but basically the light blue colored bars represent the people from within that country who told us that they didn't have any support provided to them, whether a family member, whether childcare, whether a nanny, as they're doing childcare. Whereas the kind of yellowish and darker blue bars are those who have one support or multiple supports available to them. In 12 of the 16 countries, as we would probably predict, but it's important to show in the data, those who have no support are much more likely to say that this is something that exhausts them more than they enjoy it. And really, we undertake these efforts because we believe that care is an essential part of expressing your love as a parent, as a human. It's something we all require. It's something that we can really benefit from giving. We want folks to be able to tap into the enjoyable side as much as possible. Now, following on from a similar analysis, we asked people, just regardless of how many care supports or how much support for care you have, do you feel like you have enough? And then taking only those people who said they didn't feel that they had enough care, what were some of the reasons or barriers that they felt in terms of not having enough? And as you can see, they put the blame, I suppose, or they point the finger toward how expensive care work can be as a reason why they don't feel enough support. Also, that there isn't nearly enough provision by the government of subsidized, low cost, or free childcare. And finally, on the bottom, that whether provided by the government or an employer or a city, municipality, the amount of paid or guaranteed care that they receive to have, job protected, salary protected time to care for children is not enough. So we're also trying to couch folks' care experiences within the socio-ecological framework, right? Like understanding all the different forces across society that influence that. Vessel, please. And I mentioned this before also. I think one thing that we're trying to do, and I know that around the field, the effort is there to continue to expand what being a caring person means, living a caring lifestyle beyond simply one's own immediate family life into how can we be good caring neighbors? How can we care for an environment that is increasingly volatile and fragile as we experience the manifestations of a climate crisis? And it's going to be far too many little bars and numbers here to go through on a presentation. But if you look at the titles of the columns, it's just to say, we were also asking people how many people, at least once weekly per more, could they say that they did something to take care of the planet, their environment, in routine behaviors, that they would really pay attention or contribute to political issues. We really feel that advocating for care policies and speaking up for the kinds of care that you need at work or with your friends or family is an act, toward a more equal care economy. The third being helping your neighbor, checking in on them. So, being a caring part of a neighborhood and community, or also volunteering. So I just encourage you, if you're interested in this kind of thing, to download the full State of the World's Fathers report and dig into the data. Also, this was the first State of the World's Fathers report that we did that's in the moment, we might say, where we're stepping out of the COVID pandemic a little bit and able to reflect back on the periods of lockdown. And this is just where we asked people the extent to which they felt that they increased, or the number of our respondents who said that they had increased the amount of time that they spent helping their neighbor or volunteering. And it's maybe one somewhat positive aspect that came out of this terrible experience we went through as a planet, that we saw the rise of mutual aid networks and folks looking after elderly people in their neighborhood, or those most at risk of COVID, even outside of their family. Maybe a little bit of an uptick in community care that came from this community crisis we went through. So that was my quick attempt to by no means cover everything that was included in the State of the World's Fathers report, but rather just to show how we try to bring this socio-ecological perspective, try to understand care in all of the levels that can influence it. I'm kind of resurfacing a graphic we used a couple editions ago in State of the World's Fathers to show all the different social layers where we really advocate for changes and improvements to realize a more equal, caring world, all the way from, you see, number one, the legal, political environment, down to the social, number two, down to the economics of families, number three, how couples interact, number four, and then an individual person. So we just always like to think of care as being influenced by, replicated, and reinforced at all of those levels. So with that, I'll catch my breath. On the screen, you can see the tremendous, speaking of community care, all of the different partners and supporters and contributors who made this State of the World's Fathers possible. We had 17 countries worth of new data. And I'm excited actually that our next presenter is going to take us pretty in depth to one of those countries, but you can see all of the different folks who participated. So thank you so much for your attention on State of the World's Fathers. Now, it is my great pleasure to introduce Kehinde Ajayi. She is a senior fellow at the Center for Global Development, CGD, and she's the director of CGD's Gender Equality and Inclusion Program. Kehinde's full biography in English and Spanish will be in the chat. And without further ado, Kehinde, please take it away.
Thank you very much, Brian. It is an absolute pleasure to be here with you all today to talk about some of the work we've been doing on looking at the 1 and 2 issues that you outlined in that last figure, understanding, first of all, how family leave policies, what the legal changes are, how that can improve investments in care and access to care, and then also how that intersects with this issue of social. As Brian mentioned, following COVID over the last couple of years, there's been a big increase in interest, commitment to invested in care, improving the care infrastructure across the globe. But something that's often missing in this conversation and in this movement is a focus on understanding the importance of social norms. And by that, I mean the unwritten rules that describe what are appropriate and acceptable types of behavior for people within a group or within a community. And I'll talk a bit about, if you move to the next slide, 3 things today. One, some insights we have on the intersection between social norms and the effectiveness of family-friendly policies or care-related legislation, focusing on data from the State of the World's Fathers in India. Secondly, looking at the importance of understanding social norms across contexts. So, as I said earlier, social norms are important to understand, and they vary dramatically across different places. So I'll give a bit of a flavor of what some of these social norms look like in other contexts and what the implications are for investments in care. And lastly, I'll talk about some broader work we're doing in terms of understanding how to measure the distribution of care, men's involvement in care work, and what implications that has for women's well-being and overall well-being of families. So I'll dive right in and talk about this case study I mentioned. This is joint work with Hira Faruqi and Shivangi Gokar, who are colleagues at CGD. And we had the pleasure of partnering with MenCare and Equimundo on adding some questions to the State of the World's Fathers report in India, or this last collection of data on the roles and attitudes. So India is an interesting context to study because it has a lot of progressive family-friendly policies on paper. This Maternity Benefits Act, which was recently renewed, includes or revised, includes 26 weeks of paid maternity leave for women in the formal sector, as well as a law requiring establishments with 50 or more employees to provide childcare facilities. Despite these laws, which are more than a lot of countries have, it has a persistently low labor force participation rate at 25%. So one question is trying to understand why, despite the availability of maternity leave, a lot of push by the government and other sectors to expand access to care, why is there still such a low female labor force participation rate, and why hasn't that translated to increased use of these policies and distribution of care? So based on the data, a couple of key insights, and I'll go into more things. 90% of female respondents in the India survey indicate that they are stay-at-home mothers. So there is a huge share of care work that is carried out by mothers. And similarly, 60% of male respondents say that their partners are stay-at-home parents. If you go to the next slide, please. And despite the huge amount of care work that women are taking up, both men and women say that they are satisfied with the amount of care support that they have. Over 80%, on average, 90% of both men and women are satisfied with the amount of care support available for their family. And if we go to the next slide, please. And as I said earlier, women perform most of the care work. And what's striking is, if we look at the other low and middle income countries included in the State of the World's Fathers survey, and we combine the same question, what share of them perceive that there's adequate availability of care? On the x-axis, on the y-axis, we look at female labor force participation. What tends to happen in most other countries is that as more care, as countries or individuals become more satisfied with the amount of care work, women move into the labor force. And so it's a substitution away from mothers providing care to the provision of other services that is leading to both a satisfaction with the amount of care support available, but also facilitating women's work. But in India, we see that people aren't, or households don't tend to complain or see anything, an issue with the amount of care support available. And this is coming at the cost of women being able to participate in the economy. The next slide, please. And if we go back to this, to understand why, so this is a question that Brian presented the data for all countries, and this is focusing on the India question. So for households that said that they don't have enough care, why is it that they perceive, what are the barriers perceived? And again, it's very personal. Over half of these households say that the reason they don't have enough care support is it's their responsibility. They should be able to manage it. And so it's their failing that they're not providing adequate care, which is contrasting to the other countries. And the less common response is that care is expensive, there isn't enough availability of affordable care, or things related to the availability of care services around. So there's a strong sense of personal responsibility for provision of care, especially for women, for mothers in India, based on the insights from this survey. Next slide, please. But at the same time, there is a high perceived sense of benefits from parental leave. So the survey asked, these were the questions that we included on perceptions, attitudes towards parental leave. So over 60% of women said that the increased leave for them would benefit their career. 40% of men said that increased leave would benefit their career. People also felt like increased leave would benefit their partner's career. So over 40% of women felt that increased leave would benefit their partner's career, and almost 60% of men said the same thing. So there tends to be quite a awareness about potential benefits of parental leave. Next slide, please. Both for careers and also for personal well-being. So over 80% of women said that they perceived that increased leave would benefit their partner and their children. Slightly fewer men said the same thing. And then in terms of personal benefit, 60% of women thought that, not just on a career level, but on a personal level, care would increase, availability of care would benefit them, and men at a higher rate as well. But despite this perception of the benefits of care, if we go to the next slide, please. Only 40% on average of men and women said that they would, 40% said they wouldn't use increased leave availability, and almost half of women said that their partner wouldn't use their increased leave availability. So there is still this, sense that not everybody is. It's not that the share of people who would use care does not align with the share who perceives a benefit. So if we go to the next slide, please. So what this overall highlights, using this case study of India, but has relevance for countries across the globe, is that policy design must be informed by an understanding of the relevant social norms, preferences, and an understanding of people's willingness to use the proposed policy or service. So starting with understanding what's happening in the context, and then complementing legislative reform, which can be powerful and is crucial for providing an enabling environment to make change, but must be complemented with efforts to cultivate gender equitable attitudes to care work and to deconstruct some of these social norms. I'm going to just briefly talk about a couple of other things. I mentioned the contrast. So I talked about this case of India. We're also at CGD doing some work looking at West Africa and understanding social norms in Burkina Faso and a few other countries. And there, the social norms about motherhood are very clearly focused on encouraging provision for children. And there has been a strong history of women in West Africa working, being very involved in the economy. And there is not a strong sense or norm that caregiving must be provided by mothers, but instead that resources should be provided by mothers. And so sometimes people coming from other places with a sense of social norms in other places might say, oh, we don't want to provide care, we don't want to invest in care infrastructure because it's going to be rejected by households. There's a strong norm that mothers should provide care. It's important to recognize that norms vary across contexts. So in places like some of the West African contexts we're studying, there's a very high demand for investment in care services. And there isn't this barrier faced by a sense of personal responsibility. So it's really important to understand what norms prevail in a given context and to design programs, policies, interventions accordingly. Lastly, we're doing some broader work analyzing how men's involvement in care work, increasing the distribution of care work by including men, understanding how that impacts not just men's well-being or children's well-being, but also understanding what implications that has for women's well-being. And I think this will align well with some of the broader conversation we can have about measuring the distribution of care work and understanding how changes in this distribution of care work impacts people throughout the household. I'll stop there and we can have more conversation on some of these topics later on. Thank you.
Brilliant. Thank you so much, Kende. I've got some questions for you myself, but I really want to encourage everyone here, use the Q&A function of Zoom, use the chat window, send your questions for any of us throughout, and then we'll have a solid amount of time at the end of the webinar to discuss. We want to make sure we hear your voices, hear your questions anyway, and give you a chance to respond. So I'm going to pass it now to our second panelist, Lorena Pastor. Lorena Pastor is a junior economist and care policies technical officer for the Gender Equality and Diversity branch of the ILO. She recently collaborated in the development of the ILO Global Care Policy Portal and the Investment Simulator, which I believe Lorena will share with us momentarily. So Lorena's bio in Spanish and French will also be posted in the chat. But please, Lorena, take it away.
Thank you very much. It's a pleasure to join you today and the other panelists to talk about investment in care. And the idea today is to present and to focus on the Global Care Policy Portal and the Investment Simulator, but I will anyway give you a brief introduction of the framework behind these tools within the time that I've been given, so we can jump directly into it. So I think I don't have to go deep into advocating for the importance of investing in care. There is a huge and tremendous momentum for emphasizing the importance of investing in care, and this webinar is part of this example. From the ILO, the importance of care has been recognized in several ILO frameworks and instruments, and it has been highlighted as a core sector to invest in for the just transition. It's also important to mention here that next year, in 2024, during the ILC, the ILO will hold a general discussion on decent work and the care economy. And as well that just in a month from now, on October 29, the ILO, along with the UN Women and OHCHR, will be celebrating the first and the new International Day of Care and Support. So when we talk about investing in transformative care policy packages from the ILO and specifically from the investment simulator, we're talking about this whole package because we don't only we're not only talking about providing maternity leave or providing paternity leave, we're talking about the maternity and paternity protection. We are talking about a well-paid maternity or paternity parental leave paid through Social Security to provide income security, to provide labor security, and making sure that no one is left behind. Then we're also talking about a care policy package, because the idea behind is to provide a continuum of care. We're talking about providing care for the very and each and every single life stage of the life. So providing good early child and quality early childhood care and education services with decent care work, and also long-term care for the latest stage in life. So it's how all these policies integrate to provide care through the whole life cycle. The setting stone of this portal and simulator is the ILO Care at Work report, which was published last year. I won't go deep into this. I will just mention that this report includes a strong investment case for the transformative and nationally designed care policy packages. It's a macro simulation for 82 countries, talking about the different benefits of investing in care. So the idea of the portal and the idea of the simulator was bringing this information, bringing this simulator and macro simulation to the different constituents so they can see all the benefits that means investing in care. It's about creating new jobs. It's about the gender equality potential and the potential increase in GDP that we have. So yes, this is a first glimpse of the portal. You can sign in using the QR code, or you can see the web page down there. It has information for more than 180 countries with legal and data availability for several years since 1994, because we put together information from past reports from the ILO. And then we also have the simulator, which is on the next slide. There's a short glimpse of what the simulator involves. And well, before jumping into the live demonstration, I want to just quickly explain how the simulator works, which is on the next slide, please. So the simulator allows the different users to estimate the additional investment required to provide free of charge, universal, and publicly funded leave policies and services. This is very important to acknowledge and to take into account. So the simulator used the user can change the different scenarios, but the simulator provides one starting scenario, which is, we call it the ILO scenario, based on international standards and best practices from other countries. But this can be changed. So you have the user's policy inputs, which are the parameters that the user can change. For example, the user can choose the length of paternity leave or the percentage of enrollment rate of pre-primary education. Then we also have the fixed parameters and assumptions. So there are other care parameters that the user cannot change that are also behind the simulator. For example, the number of weeks the pre-primary school, the pre-primary service might remain open during the year. And then we also have some input data for all these countries. For example, the population per age range. We also have the percentage of enrollment rate, the current enrollment rate, or the employment rate. Then it's another things to mention is that the simulator does not only limit the calculation to estimate the investment requirement for those that are currently covered. So what the simulator does, it calculates the additional investment for all the population within an age range. And it's important to understand this because the idea is to provide quality services and decent work for everyone, and not to create two different types of services just covering for those that are not currently covered. So this guarantees that everyone is covered and provided decent care as they need it. And then, as I mentioned, we are looking to provide free of charge, universal, and publicly funded leave. So we take information from 2019 as the benchmark. And we only consider the information that is currently provided by social protection. Otherwise, we consider it as not being accounted for or not being provided as we are suggesting, provided by social protection. So, okay, I'm gonna start sharing my screen to go to the portal. Hopefully technology will be on our side today. So just let me know if we are seeing the right screen. We're looking at the Global Care Policy Portal. So whenever you go to the ILO webpage, this is the first screen that you'll see. On the top corner, you will have the portal also available in French and Spanish. Then you also have this about page with a tutorial video of how the simulator and the portal works. And if you go below, there is also a technical note that I encourage everyone to read because it has all the explanation of the simulator and the calculation for anyone that wants more detail. So just quickly through the portal, as I said, it has information, legal information for all these several countries. So someone could be interested in knowing more about paternity leave. I could here select, for example, different countries, or I can also choose to see this Asia and the Pacific region. I want to know who are providing paternity leave. And I can see that in 1994, from the countries that ILO consulted information for, we had 5 countries providing paternity leave. In 2014, we had already 9 countries providing paternity leave and the duration. And from the countries that were surveyed by the ILO in 2021, we have 19 countries in this region providing already paternity leave and the duration. So this is just a very quick glimpse of what the portal has, all the different topics, the different years, and the region. So now I'll go to the ILO Care Portal Investment Simulator. So the portal will ask you first to register, or I already have my account, so I would just log in. The registration is very quick and it allows us to see what constituents are simulating, which are the countries they're interested in, which are the topics they're interested in, and what are the different parameters that are using. So I will log in. And I already have run some simulations, so for the sake of time, but whenever you go into the simulator, you can start with a new simulation. You can choose whatever country from the 82 that we have here. We're trying to introduce new countries by the end of the year. We're working hard on it. And you can choose the projecting year. You can change the name of the simulation that you're doing just in case you want more information, because you can have several other simulations on top, the country, the year. Here I have more information. Then, as I mentioned, the simulation is run for the ILO scenario, and the user may be wanting to change it according to their preferences. But if you ever want to go back to the initial ILO scenario, you have the reset option, or you may want to delete your simulation at all. And so we have these 4 policy areas, and I'll jump to the first one. So we have Rwanda. Rwanda in 2019 was providing 12 weeks of maternity leave. These 12 weeks were paid by the employer. However, 6 weeks were reimbursed by the social protection. That's why we have here 6 weeks. They were providing around 4 or 5 days, if I'm not mistaken, of paternity leave. Now it has been increased to 7 calendar days, but it's paid by the employer. And so what I want to do in this demonstration, or when I want to simulate, for example, today, is, okay, I'm gonna pay the new 14 weeks that now Rwanda has of maternity leave, paid by social insurance. Then here is the explanation, because the paternity and maternity leave has been all homogenized to be calculated in weeks. So we are talking about calendar or working days. So here's all the explanation. So for paternity leave, for example, 0.6 weeks is equivalent to 3 days, because we're talking about 5 working days. So let's say I want to simulate this for 14 weeks of maternity leave, 1.3 weeks of paternity leave. We're talking about like 7, 8-ish days of paternity leave, working days of paternity leave. This is for formal employers. I'm not providing parental leave in this simulation. I'm going to do the same for formal self-employed. This I'm going to be providing 14, sorry, here. This is the way that you can change it. And then I'm also going to provide the same duration for informally employed. Then I have the other policy areas. For example, I have the breastfeeding breaks. I'm providing here 60 minutes of breastfeeding breaks for 6 months, according to the suggestion by the WHO. Then I have also the different parameters for the early childhood care and education. These are all the parameters. And another thing to mention is that the simulator does not allow for the investment in care. It only allows for the additional, we're talking about the additional investment. So even if I put 0 here, it would mean that I will stay in the current state of the current state in the country, the current state of the care policies. And also, even if you try to put the same or a very similar percentage or amount or value, we're still talking about decent care, well-paid care. We're talking about, for example, in early childhood, kids that will be taken care of during 40 days during the day, 40 hours, sorry, during the day, 40 hours during the day, so that parents can go to 40 hours during the week, sorry, so that parents can go to work and have have somewhere to leave their kids and don't have like half of the day without knowing what to do with their kids. So we're talking about decent care, we're talking about decent services. So even if you choose a very close value, might still give you an additional investment in care that will be needed compared to the state of the world or a state of the country in that moment. And so again, these are the 4 policy areas, the different parameters that the user can change. And at the bottom, we can see that if we want to provide this 14 weeks of maternity leave, this week of paternity leave paid through Social Security, this breastfeeding breaks, and all this package of care, we might need to invest an additional amount of 4.27% as a percentage of the GDP. It will also provide it will also generate new employment, and will also have a return on investment for the society as a whole. It will mean $2.65 per dollar invested. It's not a return for the government in itself, it's a return for the society, because we're measuring this ROI in terms of the potential wage that women might be able to get if they stay working, if they are receiving leave that is paid, if we also invest in childcare education, so they don't have to take informal jobs, they don't have to go to take part-time jobs to take care of their kids. And so we also provide all this different information and all these different results per care policy area. And all the information and the results are in terms of the investment requirements. We're not talking about costs here, we're talking about investments, because we're talking about the benefit that it might bring for the society as a whole, we've been mentioning. Then we also have the return on investment, as I've mentioned. Here's more information. If you hover over the icon, the information icon, then you have the job generation. And finally, there's also there is also the investment case in terms of the gender equality in employment and wages, because we know that the care economy mostly depends on care work from women. So most of this care investment will go to generate more employment for women, and also mean an advance for gender equality. So the same results. I won't go through all the different policies. At the bottom, we have the download results in Excel. Sometimes it's useful to have it in Excel and not only on the screen. And yes, this is basically it. It's a very quick demonstration. I encourage everyone to go and try it, because I think that's the way that you can really go deep into it and learn all the different aspects of the simulator. But yeah, thank you very much.
Amazing, Lorena. Thank you so much. And okay, attendees, be honest. How many of you are still here with us? How many of you already went over to the simulator portal and started plugging in for your countries? It's really, really incredible. Lorena, could I ask only very quickly an immediate follow-up about the number in terms of like return on investment dollars that you were showing? Is that a percentage of a dollar? So like 2 cents or something? Or is that like $2.69 for each dollar? Does that make
It's
sense?
$2.69 per dollar investment. Yeah.
Amazing. So 269% return for this increase in GDP. Awesome.
Yes.
Okay, we have one more panelist with us. I'm really happy to invite Tanima Ahmed to speak. Tanima Ahmed is an economist with the World Bank Group's Invest in Childcare Initiative and Gender Group. You have the responsibility of going last, Tanima, and giving us your reflections on everything and what the World Bank is up to that speaks to this. Please go ahead.
Thank you, Brian. I'm delighted to be here and part of this very important conversation. I'm learning throughout this process on measurement and the diagnostic and the work going on, and I'm super excited to be here and talk about what we are doing from the World Bank, and then moving us from measurement to investment now, because one of the part of this conversation, I think, is where one part is measuring, but one part is also going forward with this measurement to investment. So I'm focused more on this investment part, but I also think analytical part will also come in. So in my experience, I'm working in this field for long. I also work for this Invest in Childcare initiative, which is which is in the World Bank, which is launched in 2022. And what we are focusing on is working with the governments, working with the institutions, working across to increase investment in childcare. But again, I will say that care economy is broader. This is one part of it, which is childcare, but you can also think about elder care. I'll not focus on that, but more into the childcare investment perspective I'll bring. So when we think about investment, and also from Invest in Childcare Initiative, we think about investment. I always feel like it's in two buckets. One is analytical, because you also need to invest in analytical part of it. And also the other part goes towards the operational part, where we are bringing this analytical and using the analytical to go and support the governments to increase the access to childcare and to provide institutional, to change the institutional like policies and other part of it. So we already talked about analytical a lot, I think, throughout this process. You have the report, a fantastic report on state of world's father. I think this is very crucial to think about men as well in this equation. And Gandhi talk about India and how the norms are also an issue here, the diagnostic. So I think analytical investment is very, very important, and we're also doing it. So I always see analytical investments in like multiple parts. And to me, it's like time use is absolutely very important, so that we know what's happening in the country or what's happening globally. It's not only a country, but it's also a global level that you need to know what's going on in this space. So time use survey is very important in valuing care, in measuring the gaps, in understanding the context, understanding the distribution of care between men and women, and even other groups. So that's one part where we are also, Invest in Childcare team is also like focusing on that. The World Bank is collecting data. We have LSMS survey. We're incorporating the time use so that we have those data available, because it seems like it's not available throughout the world. Some countries have it, some countries don't have it, but we need it for all countries to understand what's there. But other important part where I want to focus on also investment in diagnostic. And I think Andy already mentioned about it. And that is so important, because when you are investing in care, you need to understand, and one size does not fit all. So you need to understand the country context, like what's going on, what's the supply situation, what's the demand situation, what's the institutional situation, who do you support? Because you will see in many countries, it's always kind of a complexity stays, that who is in care. Like, for instance, you can talk to Ministry of Education, or do you want to talk to Ministry of Women? Like, who do you basically support to increase this investment in care? So this diagnostic basically brings those kind of information, and also thinking about norms. From my experience, I'll just talk about, like, I am working with Indonesia team, and I also worked with the Gambia team, and I see that in Indonesia, even though we were like asking these questions while diagnostic to measure the sentiments, the government is very interested. They're like, yes, let's go for it. Let's invest in childcare. We need this. But then when we ask these questions on how much are you willing to take up, like we ask these households, like we provide care support, we have childcare set up, then what happens? And 89% we saw that saying we don't want to send our child to a childcare center. And that's, to us, is like, okay, so then you have to, when you go for investment, you have to think differently when you see this situation. Whereas in Gambia, we saw that people are more willing for take up because they said we don't have access to it, and we need an affordable childcare and quality childcare so that we can go to work and we can do our work. So this kind of diagnostic basically brings us the sentiment of government, the sentiment of households, and also the supply situations, which is very important, like what entry points you go towards. And the last is return on investment. I am really happy to see this care simulator, because this is a key to go to the government and kind of talk about that, hey, look, invest in care because you have this return, because it's always a return on investment that you need to think about when you are actually supporting the government or supporting any kind of investment. So I'm really glad to see this kind of work is coming through. And we are also working on return on investment from our end, from Invest in Childcare Initiative. We are working on situation assessment instruments. We are working on guidance notes at the global level as well as at the country level. I think that's very important to think about, that we need global investment. We also need country investment, because one size does not fit all, and we have to think very carefully through it. But let's move towards the operation. So once we have this diagnostic, I think one of the most important part, and we already talked a lot on measurement, but moving towards the operation, there is multiple entry points that we see when we are thinking about operations from our end as well in countries, right? Some countries are like the entry points goes more towards the policies, and government we see has appetite to work on the policies of care sectors, whereas some entry points looks into how to increase the access or to affordable and quality childcare. So there are multiple entry points that we need to think about, and we from the World Bank are thinking about, like, many countries are going through many entry points, and it depends on what entry points you're getting in which countries. So that's why the diagnostic becomes very important to have this conversation going on. But some of the key highlights that I can think about the entry point in the entry point side, and when we are going for the investment, one is expanding the current programs. Like, for instance, we have seen the community platforms, which is very important entry points. In some areas, we are seeing that communities are doing already this kind of childcare support, maybe in a very limited way, not a quality service, not maybe affordable, maybe not affordable. Only community services can affordable. So we get that entry point. Like in Cote d'Ivoire, we have seen this in nutrition. There's a nutrition platform where they were providing childcare for 2 days. And we thought of this as an opportunity for us to expand the model, to make it a quality service, to go there and have this expansion and have this service given to the parents, not only for 2 days. You need support for 6 days or 5 days or throughout your working hours. So that's one entry point. And community platforms is, we're seeing that for an investment perspective is very, very important, because we see in many places these community platforms are there, and we can kind of go in and expand and think about expanding it. Again, coming back to care economy, it's also the workforce. There is also entry points towards, like, investment goes towards integrating childcare as a training track, right? Because if you need a decent workforce, you also need investment on training those childcare workers who need training. I mean, we have seen in many countries, there are childcare workers who does not even have education, but we do not want to take them out of the market. What we want to do is give them the support to have a decent work, like to have training on childcare, to provide a quality service, right? So that's another entry point that we see. We also see from the supply and the entrepreneurship, right? There's investment needs from the supply side as well, because you need increase the supply, and the entrepreneurship models are also very important to think about. And we have multiple projects where we are testing that whether the impact of entrepreneurships on revenues, how it impacts the households and other aspects of it. We have impact evaluations on that, but we also have country teams working on investing in this kind of space. Expanding childcare through educational system. We also have preschools, but we see that, for example, in Indonesia, when I was I'm working on it, we see that the childcare is 3 hours. So the question is, does it? I mean, you have childcare available for 3 hours, but does it really help the parents to go to the labor market, or helps the women, or helps the father to go to the labor market and work, because 3 hours may not be enough support. So going through that is also very important. And then coming back to, we are talking a lot about policies. So coming back to policy is a very important entry points too. The employer-supported childcare, the employer-supported family-friendly policies. I always say this, like, I think the policies should be gender neutral. As we are talking about fathers here, I think this is very important that we make it gender neutral so that we can have a redistribution. We can break these norms that is only the responsibility of the mothers. So this gender neutral rather than paternity, maternity, we are also working, World Bank, other teams are working on parental leave because it's very important. There are studies which shows that parental leave really helps to redistribute to an extent, because then men can be more involved with childcare, and then they end up doing more childcare. Family-friendly policies are very important, not only for childcare, but it is also to support elder care, because family-friendly policies, and it needs to be targeted. I mean, I always say gender neutral. It needs to be done in a way so that it redistributes from women to men, and we can see a more equal distribution of care work. There are other institutional definitely issues as well. As I said already in my when I was talking about it, that who has the mandate from the government, right, to think about these policies, who we support, and how we deal with these policies, who brings the policy on table, and who goes forward. So that is another entry point as well, and an important one to think about. So from the World Bank side, not from the World Bank, even like when we see the trend, I mean, ILO is working on it, CGT is working on it, we are working on it. We are seeing a multiple kind of entry points going around, and I think different countries, and also in one country we see sometimes that different work is going on, but then also we are trying from Invest in Childcare initiative to maintain coherence across this kind of investment, or this kind of entry on investing in childcare, to motivate to support the government in doing it. So that's very important as well in going forward. But then again, as I say, like, data is very important. Having this support system is very important. But again, I'll come back to what Brian has said, that we also need to look beyond childcare. It is not only about childcare, it's also about elder care and other sort of cares. And we have seen this in a report too, that these fathers are also supporting elder care. So from gender group, actually, we are going more broader on elder care and childcare. And we have this, we recently published a thematic note on care. If you're interested, I'll post the link here. Please go ahead and check. It's on a broader care economy. It's up input to a gender strategy update that's going on right now at the World Bank. So I'll post the link, but I think we need to think about it. We need to think of care economy now. It's very crucial, not to say that to increase women's labor market participation, but when I say that, I say we need to invest in care to increase women's and men's choice in life, that what they want to do, whether they want to go to the labor market, whatever it is, we have to present them with a choice. And investing in care economy is a win-win-win-win for everybody. So it's a win for everybody. So we should think about it. We should invest in it. We should collect data, measure it, and invest in it. I'll stop here, and I will just post the link. Thank you.
Oh, amazing, amazing. I feel like this is about the most enriching hour of conversation about investing in care that I've ever experienced. Really, just amazing presentations. Thank you all of the panelists for giving us your time and your knowledge and your expertise. It's really been excellent. Thank you to the attendees for sticking with us. And I am excited to see a couple questions coming in now. So I'll take a breath. And now we're going to have just a little bit of time. We do have about 25 minutes reserved left in the event today. We'll see, maybe we don't need to use every last second of that, but we are here through that time to make use of it. And I see a couple questions coming in the Q&A now, which really mirror the way I was already thinking, that it seemed that a link throughout all of the presentations was how there are lots of different entry points we need to be thinking about at once. And Tanima just listed a lot of different ways to think about entry points of investment. Lorena's walking us through the simulator showed all the different kinds of policies in particular that we could, toggle up, toggle down, whatever it is. And then Kende did such a great job, of course, of situating the current stats in India against a social norm background and thinking of ways to be engaging at levels across that social infrastructure and social ecology. So seeing the first couple of questions that came from Fiona in the Q&A, one is about kind of social protection as a particularly important entry point. Another about kind of going above and beyond childcare services in places where maybe folks wouldn't be as willing to use those. And I wanted, if I could, to hand it to Kende to reflect on these and kind of point us toward some of the entry points, whether in India or elsewhere, that you feel would be great starting places. Please.
Thank you for these questions and for framing everything, tying it all together, Brian. So on this question of going beyond, looking at parental leave and going beyond thinking about service delivery and shifting towards something that's more robust across the care infrastructure, I completely agree with that. I think that, my key takeaway from all of the differences in social norms that we see across different contexts is, first of all, that there's no one universal approach to addressing care. That it's critical to understand what types of care support, what types of programs, policies, legal reforms are most effective at supporting access to care for different types of people in different contexts. And so we need to think more broadly than the approach most people take is either set up a bunch of childcare centers for people to take their children to, or change the parental leave policies. But when we have all these underlying factors about different social norms, different preferences for types of care, different intra-household dynamics in terms of who is providing care and what's happening, then it's important to really, first of all, understand the context and what are the real constraints in that context, and then provide investments that respond accordingly. And one example, social investment is critical, but also things like strengthening the quality of home-based care in places where there is informal provision of care by people other than parents. Also thinking about things like making sure that there are clear amount of data available to understand what's happening in different contexts. So I'll end there by saying that there are different models of providing care, and actually I should mention that in a couple of weeks, I'll put this in the chat, we're going to be hosting at CGD an event on highlighting approaches to early childhood development in Africa, and part of the goal there is to highlight that there are different approaches and that change over time and the different approaches to care provision. So the key takeaway is there is not just one approach, there are multiple approaches, and it's critical to ground these efforts to invest care in an understanding of the social norms, the opportunities for economic participation for women, for example, and all the different moving pieces that impact the distribution of care.
Amazing, Candy. Thank you so much. If I could just turn maybe to Lorena just for a second now, as you were, obviously it's really a brilliant tool, the simulator, and I can already imagine all of us going in and plugging in the countries we work in or where we're from and making these estimations. I was kind of wondering if you could reflect on the ideal uses that you have in mind. Like I was already imagining, if I had an avenue toward a Ministry of Gender or a Ministry of Health, I would want to plug in some of my recommendations right into this tool, print it out and put it on their desk, like, look at the return. Would you advocate for using the tool directly in interface with government, or what's the hope?
Yes, thank you for this question.
Sure.
Yeah, the idea behind is that, so through life, we will either be providing care or receiving care at one point in our lives. We're talking about the life cycle, not only leave. So I think that because of that, it's important to provide quality care. And there is a huge necessity in understanding that there should be provided as a package, as a continuum of care from the start to the end of the life cycle. So I think that's one of the things that the portal and the simulator allows you to see, and also the different benefits that there are. So we are already in contact with several, from the ILO, with several countries. We are already providing them with technical assistance, and we are using the simulator to tailor-made these different types of leaves or provisions that I want to give, and we're providing the technical assistance so they can use this with their governments and to start the conversation going, to start the design, and to think about how to better design these policies, what should be taken into account. And I agree with Tanima said, like, there is not one solution that fits all, but I think that the portal allows to get the conversation going and to think about the different parameters that should be taken into account. And yes, I think it's a huge tool and should be used more by governments and by different organizations to look at the different benefits. It's not only about creating more jobs, it's about gender equality, it's about good and quality services for the whole population and the society as a whole.
Thank you so much. I know we had a comment from Shub in the Q&A and also a question earlier from Johanna Gomez, I believe was the name, asking about the time use surveys that we've used, and also like the need to go beyond simply attributing time use. I shouldn't say simply, because that's a very, very complicated thing to do. So to Johanna, I wanted to say that in the State of the World's Fathers data that I showed earlier, that was actually a result of original research that we coordinated in 17 new countries. It was a survey that we developed ourselves and implemented with dozens of partners, as I showed in one of those slides. So State of the World's Fathers over the years certainly does draw from other time use surveys and data from partners here and external partners, and show kind of the latest state of the knowledge of care equality around the world. But in this particular edition, more than ever before, we were presenting original new data. So it wasn't exactly the kind of thing where we were going to these 17 countries and just looking for whatever time data already existed. We actually generated the new data through coordinating a new survey. Now, if you're coming from Colombia and have deep work on estimating care use and want to be involved in this in the future, it's amazing that you're here. Please stay in touch with us, visit the MenCare website, get in touch with Vessel or myself. It's very, very possible that for future editions of State of the World's Fathers, we could involve you or your organization as data collection partners, or we could, lift up the data that you have as part of our continuing efforts to speak to this as globally as possible. And just Shub's comment in the Q&A was also about just how incredibly difficult survey research around time use is. And I think my personal reflection, and honestly, Shub, I sort of decided not even to really go in and show the kind of basic time estimation data that came out of the State of the World's Fathers survey, because we have ILO present on this call. We know that the way that we asked those questions was not exactly like the most rigorous 24-hour time attribution kind of methods that you would potentially do. And it's always a trade-off, right? Like, we could do the most thorough, accurate time estimations among people, but then that's already such a burden, and it wouldn't then be feasible to also be asking about social norms and also be asking about care, like willingness to update policies, and also be willing, to respond about COVID changes. And to be honest, our mission is a little bit to speak as broadly as possible to global themes. And so that sort of means that we choose methodologies on the side of speaking to as many places along that socio-ecological model as possible, even if we have to put forward a lot of, limitations, caveats about the, the nitty gritty hours and minutes of the time estimation. We really still stand by, particularly the data I showed of the ratio of men's time versus women's time and all the other crosstabs and things that we have there. But just to second you and totally agree how challenging the methodology is of all of this. So I'm not seeing any more questions. I know we are always in a busy time of year. I think I will maybe move us toward a conclusion if the panelists don't object. And I wanted to just really make sure to thank again, Kehinde, Tanima, Lorena. I want to thank Vessel Vandenberg, the global coordinator of MenCare and also a co-author of the State of the World's Fathers report. Thank you to Gary Barker, our founder and CEO, and a co-author of the report who was here earlier. Also to our fellow co-authors on the report who weren't here, that's Dr. Tavishi Gupta, the director of research from Equimundo, and also Nikki Vandergaag, our senior fellow who's been such a leading voice in this world. I want to thank our colleagues who helped the behind the scenes in making this event a big success. That would be our Director of Communications, Jose Campi Portolupi from Equimundo, and also Hannah Chosid from our team. And thank you as well to Lilia Rubio, who's been doing the interpretation in Spanish. So those are my thank yous. I did see from Mora, thank you, Mora, for we have the time. Let's get one final question in before we conclude. And Mora has asked everyone if we can share any good experiences or examples of policies that have generated cultural changes in favor of greater co-responsibility for care. And this is a fascinating part of it, right? I keep talking about we need to change things at the level of policy and culture and social norms and community. And it's funny how sometimes one can lead to the other or the other can lead to the other. And I think, what stands out to me from even Kehinde's example is, okay, here's India. Here's a place where in recent years, there actually are more beneficial policies. You could point to, and we never want to really single out countries in any way, good, bad, or otherwise per se, but you can look at an example like Japan, which we've known for a long time is a country with tremendously generous care leave policies and paternity leave policies for men, but relatively low uptake of those. So in some countries, you're seeing the policy is way out in advance of where the social norms are or where the behavior really is. And so in those countries, it's how do we find those levers to shift social norm and acceptance? How do we make it more acceptable in workplaces to take leave? How do we just shift even media narratives and conversations about care work? And then if I could even speak to my country here in the United States, I feel that we're kind of in a flip-flop situation where the policies, at least at a national level, are abysmal. We're the only large economy in the world with no guaranteed paid leave for even mothers of children, let alone paternity leave. And granted, some companies have stepped in, some cities have made improved policies, and we are pushing toward a more positive trajectory. But generally in the US, it's very much on a class divide. You may have very good paternity leave and maternity leave policies, but only if you're a relatively high earner at a pretty big company who uses those policies to sort of recruit the already most advantaged employees. So that's a case where the social norms are almost need to be driving ahead or out ahead of the policies, right? And that's why the contextual analysis is so important. One of the really old examples from our work that always comes to mind for me in terms of this question was a policy, and please, if there are Chileans here or someone who can speak to the South American examples more closely than I can, please correct me. But over a decade ago now, Chile, and this is a small component of what care means, but I think it's a powerful example of this. Chile passed a law which made it which flipped the situation from, it used to be that fathers were prohibited from being present at childbirth. It was just like absolutely not socially or legally normal for the father to be there and be present for the birth of their own child. And they passed a law based in part on some long ago research that we had partnered in, to make it so that it was the default, actually, that fathers were expected and welcomed as a default status to be there and be present for the childbirth. Now, we obviously want policies to go much more beyond this one crucial moment, but I think we were able to chart immediate social change that followed policy. Like, the new law then generated a new norm where suddenly it became normal and became something that parents of all genders really valued, that they were able to share that moment of childbirth together, and fathers no longer felt excluded, which then meant, a fair proportion of them, allowed themselves to be included in a more social family way in the care work that followed after childbirth and in those crucial early months. But I wonder if any of the other panelists wanted to pick it up from me and have any other reflections on examples of like policy leading the way on social change. Does anybody feel ready to take that one on, or even you, Vessel?
I can just quickly, I just wanted to have some 3 quick comments, and you covered it all, Brian, like completely covered it all. But I still wanted to highlight these three things that I always think about policies. In this space, we are very, I would say, for me, I feel like we are very new at this point, because there's so many countries we do not even have policies. But overall, studying the literature, what I have seen so far is parental leave is something we are seeing increasingly that helps in redistribution a bit. We have seen in some examples in Canada and other countries which adopted this kind of parental leave policies, it helped. But then again, the question is, one size does not fit everybody. Country to country, it varies. Maybe it worked in one country, it doesn't work in the other country. It doesn't go that way. So and paid family leave, you talked about US. I'm seeing the paid family leave is very new, and then we have seen some impact of it too, but it again varies by state, from state to different kind of like where you're implementing, what is the take-up rate and what you do. So I think that's one crucial thing to remember. We are still working on it, but it has to be very contextualized when we think about this kind of policies. The other thing I wanted to highlight is informal workers. Even if we think about policies, we need, parental leave or paid family, those are only for the formal sector workers. We need to think a bit differently when it comes to informal workers. And the percentage of workers who is in the informal economy varies widely from country. If you look at Africa, it's really high, that at that point, if you have even policies for paid family leave, but you don't cover a big chunk of this labor force participation, women's and the men, because they are informal workers. So then you have to think differently of what policies you need to think about and what we can do for informal workers. It's most probably more social protection based stuff. So it just have to think differently at that point. And lastly, I want to again just highlight that implementation matters. We can have a lot of policies coming in, but we see that things fall through because of the implementation doesn't take place, and no one follows up on these policies. And again, it varies from country to country, but this is very important, not having a policy, but also implementing it and seeing how it can be improved, or seeing that whether private sector or the employers are even using those policies are so important. So I just wanted to highlight these 3 points on this topic.
Kende, please go for it.
Thank you. So I replied in the Q&A, but I realized that it's slightly different. So I would say there are a lot of successful programs that have been effective at addressing these norms or encouraging co-responsibility in care. And a lot of the work that Equimundo and MenCare does is related to that. So there's a lot of evidence on the effectiveness of facilitated conversations, bringing either men alone together or couples together to discuss and role model, provide guidance in terms of addressing some of these norms. In terms of policies, I think it is trickier there. One thing I would highlight is that we often think about care in isolation without recognizing a link to economic opportunities or things outside of the home. So if we look historically in the US, for example, at what has happened in terms of changing the amount of women's labor or participation in the labor force, things like changes in policies about what type of work women can do, encouraging women to do certain types of work leads to a shift outside the home. But then, the question of, in a lot of places, women are still providing most of the care inside the home at the same time. So I think complementing, in some cases, it's a question of lack of opportunities or lack of recognition of opportunities outside of the home for women to engage in other types of work apart from providing care. And lack of recognition, remuneration for the work that women do. But there's also a big sticky question of how do we bring men more into doing things in the home when women start working outside the home? And how do we also effectively have a situation where it's women also shifting out of doing that care work? Because there are a lot of examples where men have started to do more, take more, contribute more to care work, but women don't do less. So really thinking about how you get both men contributing more to care work and women at the same time contributing less to care work. So we have this real redistribution instead of an overall increase, which is great. I should emphasize, even in those cases, it is great to have more participation in care, more contribution to care work, but really understanding, I think a stickier question is how do we then also make sure it's a complete redistribution so that there is a reduction in the amount of time that women are spending in care. I think it's still a tricky question. There's still more to learn on this, but I think a big part is highlighting care work as important work instead of changing the framing of it as being a burden or being a task that someone the dirty work or hard work that people have to do, but recognizing that it is a positive contribution to overall well-being. So framing that and through using that language, the recognition of the importance of care work throughout the discussions about it. And then also recognizing that it must be properly compensated for. And this leads to your point, Tanima, about and not just within formal sector, but the huge amount of informal care that's provided, also recognizing that that's important care work that must also be valued and recognized. I'll end there.
Oh, please, Lorena, go for it.
Yes, thank you. So I can this saying like it's a very complicated question, and I think that good experiences can take different forms depending on where we're talking about. Because, for example, in some places and some countries where they don't even have paternity leave, or paternity leave can only be taken through a special circumstances or emergency leave, the fact that now they're introducing a paternity leave by its own, like with their own name in the legislation, I think it's a huge cultural change. And then on the other aspect, we also have countries that have already parental leave and family entitlements, and they are seeing that, yes, at the social norm, we know that women are still taking most of this parental leave and parents are taking just part of it. So they are starting to introduce a specific leave for parents or reserved leave for parents to make sure that we are aiming for some equality. So I think that, yes, good experiences and good policies take different forms depending on what we're talking about. And it's also about first, okay, setting the minimum, setting it into the law, getting into the law, setting the legislation, well paid, and based on collective bargaining and social dialogue. And I hopefully that will also translate into the social norms that Hindi has been talking about and showing us that they are linked, but still, it's a tricky situation. Is that it's a very complicated problem, but we're aiming to that.
Thank you all so much. Please stay connected to the MenCare campaign as you go away. This was the fourth of a six planned webinars, so I expect there will be a couple more invitations to come. And be in touch with, I imagine, both in the the webinar website, or sorry, the MenCare website where the webinar video and details will be posted. You can access the slides, and I'm sure that the emails and contacts of the panelists are available as well. Just we encourage you all to stay in touch with us, get involved in MenCare as much as you can. And thank you. I think with that, we can close.